afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Robert J. Havey, MD Institute for Global Health, and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions every Tuesday and Thursday here on the Havey Institute for Global Health's Facebook page. And today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest headlines that we've received through today, the 28th of September. And we invite you to submit your questions via Facebook to us at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. And leading the discussion today is Sophie Buskowski, a student research assistant with the Institute. So Sophie, I now turn it over to you.
Hi, thank you. Thanks, Dr. Murphy, for being with us today. So some good news with our updated COVID statistics. There has been a rise in COVID vaccinations, especially in Illinois. With under the age of 18, there's more than 16% of the population fully vaccinated. And overall in Illinois, there's been 52% fully vaccinated. Another exciting news is that in Florida, there has been a decline in 53% of the cases over the last 14 days, which is incredibly exciting news. And overall, in the United States, there has been a rise in vaccination with 55% of the population fully vaccinated. What can you tell us about the rise in vaccinations and the decrease in cases over the last 14 days?
I think people are finally getting the message that they need the vaccine, and the mandates, I think, are happening. People that were right on the edge there, do they want to really lose their job because they don't want to take a vaccine after they've taken, half a dozen other vaccines in their life? And the experience we have with over 180 million people being vaccinated and well over 200 million vaccine doses just of the Pfizer product alone. I mean, there's so much experience. So a lot of people have, gotten over that hurdle, and have taken the vaccine. So that's one thing. But the mandates have really helped. Now the numbers are going down because the vaccine used in many parts of the country, especially some big populous states, has gone up a lot. And that's one reason. In Florida, despite them having very little mitigation efforts ongoing and anti-mask policies, they actually have a fairly high vaccine rate. And so many people have gotten infected down there. They have a combination of natural immunity and vaccine immunity. And so you're seeing the cases drop off there. And that's terrific for them.
That's wonderful. And moving on to some headlines, the CDC has now approved for a Pfizer booster for certain populations. What can you tell us about that and the populations that are being approved?
Well, it's very, a lot of people are very confused about the boosters. The bottom line is the impact of the Pfizer vaccine compared to Moderna starts to go down about 4 months after the vaccine has been given. And hospitalization protection by the vaccine decreases. This is not good. The Moderna one seemed to hold up a little bit better in a study that the Centers for Disease Control oversaw in multiple states around the US. And the effect is real. The Israelis also found basically the same issue, and most of the Israelis who got their vaccines relatively early compared to us, and almost exclusively with the Pfizer product. So they have the experience as well. And they actually implemented the booster program along with some other Western European countries before we did here in the United States the other day. So it's clear boosters are going to be needed. The only question is when. What is the optimal time to give the booster? And so the time for a lot of people is now. So the CDC approved for over 65, people under 65 who have underlying health conditions that put them more at risk. And so that goes down to age 18. Notice it doesn't go down to 16. And so the other big contentious issue between the FDA and the CDC advisory boards was that they also include people who are in, quote, essential job positions, such as healthcare workers, people who work in residence facilities. But I mean, it's gone even more than that, grocery store workers, this worker, it's pretty vague. And so people are confused. But if you think you're working, I believe the way it's basically an honor system. Nobody's going to check up on you. No one is supposed to check up on you. And you just have to sign an attestation statement that says I'm at risk. And you can go get the booster if you're 6 months past your second dose. So that's basically where we are. Very confusing message, but the concept is the same. You're going to need a booster. The question is when.
Hopefully it becomes more clear in the upcoming weeks.
Well, the only thing it's going to do is they're going to just open up boosters for everybody. That's the direction that we're going. And there's plenty of vaccine. There's over 40 million doses available, and their production capacity is increased significantly. So, you know, it's not like we're going to run out of these vaccines.
Right. Well, moving on to children from ages 5 to 11, there has been a vaccine approval in Pfizer for children ages 5 to 11. What can you tell us about that, and what's that looking like for the upcoming weeks?
Well, their trial is pretty much done. They're analyzing the data now for the 5 to 11s. And there was a very forward statement by former FDA Director Scott Gottlieb the other day on TV, and others that have said it's going to be, this approval will be sooner rather than later. It will be in days that they will be presenting this data. And then it goes through this process where the FDA advisory committee looks at it, the FDA then makes a decision. The CDC advisory committee takes a look at what the FDA just did and looks at all the data again, and then they make a decision, and then a guideline is written. It actually goes pretty quickly. It takes about a week to 2 weeks to go through that whole process. But it looks like it's going to be definitely October that this group is going to get approval.
Well, that's really exciting.
Mm-hmm.
Vaccination workers in New York are facing deadlines for the mandate. What can you tell us about how this is going to look like for nursing homes and healthcare workers in shortages?
Well, there's always a group of people, and it ranges in percentage or proportion of people. You know, it depends on the group. So there's still this within the healthcare worker group. There's still some approximately 15% of people that don't want to take the vaccine. But this is just not, like, we're not going to let anybody in the hospital who hasn't taken a flu vaccine. And, you know, pretty much all the health authorities say we have got to mandate it in healthcare workers. Other fields too are going through the same thing. The police are having a huge issue because they even have a higher rate of
Right.
vaccine hesitancy. So the state of New York was the first one to put this in place. The deadline is, like, I think very soon, or just happened. They are went to court. The court blocked the mandate, and then the appeals court unblocked the mandate. And these people are going to be terminated if they don't get the vaccine. It's just too unsafe for others to let these unvaccinated people work in a medical facility with all the sick people that are around there. It's just unfair to them.
Right. And the United States is easing travel restrictions for fully vaccinated foreign visitors sometime in November. Can you tell us a little bit more about what that's going to look like for more foreign travelers entering into the United States?
Well, it'll be a little bit easier to travel. Right now, also, it's very complicated. They have this system of rating countries and whatever, but it fits in line with what the other countries are doing, what's happening in the world. Basically, you're not going to be able to travel internationally without being fully vaccinated to anywhere.
Well, hopefully this will open up soon.
Yeah.
And moving on to some questions from individuals. To start with, you know, the new study, the Israeli study, is showing that the SARS original strain is 27 times less likely than never infected vaccinated people to get Delta and to develop symptoms from it or being severely hospitalized. Dr. Murphy, are you aware of any studies that are showing natural immunity is less effective than getting a shot?
Well, in general, this is one study, but you do get immunity after you get COVID. I mean, you definitely get immunity. The problem with the immunity you get from the infection is that some people get really great immunity and some people get very limited immunity. And before the vaccines, we started seeing reinfection in people who had COVID within about 3 months after the first time they had it. The vaccines give a very standard antigen exposure dose And the response is pretty much the same in almost everybody, except if they have some immune deficiency where they can't make the immunologic response. So those sick people are a little bit different, and they're typically excluded from the studies. So the vaccine response is more predictable and stronger and lasts longer overall than just getting COVID itself. Now, if you get COVID and then have the vaccine, you have even greater immunologic response. Having COVID is almost like a vaccine dose, they call those hybrid patients, and they do actually very well. So people who've had COVID should take the vaccine. You're going to have a great immunologic response, better than people that just had the vaccine.
Absolutely. And the second question goes, my sister keeps sending me articles to show me that since she had COVID and recovered, she should not get the vaccine. Her argument is this is because of natural immunity developed through some kind of memory B cells that continued to evolve and get stronger up to a year after recovery. She says she personally knows 5 people who have gotten severely ill after recovering from COVID and were also fully vaccinated. Would you recommend someone who recovered from COVID to get the full vaccine, or maybe just one shot?
No. We sort of touched on this in the question before,
Yes.
but the people who do not take the vaccine who had COVID do better than on people who didn't have COVID. All right, so it's like almost like a vaccine dose itself, but it varies between people. Some people have a good response, some people have a bad response, and the vaccine improves that response for everybody, regardless whether they had a good response or a bad response. So if you've had COVID, that's still, you're going to benefit from having the vaccine. And again, if you want to travel internationally, or work for the police department, or as a healthcare worker, or some other a company that's mandating vaccines to protect its employees, you're still going to have the vaccine, even if you had COVID.
Absolutely.
Yeah.
So last year, this individual was working in urgent care and developed an unknown rash that they had on and off for about a year. They tested negative for COVID multiple times, and then they had a close COVID exposure with their child and partner testing positive in November, and she continued to test negative, even when taking care of them and having mild symptoms. This individual also did an antibody test, which showed no immunity. Since this exposure, she has had unknown rashes that have been on and off for about a year, and she is fully vaccinated. Could this individual have come in contact with COVID and still become negative, even with some mild symptoms?
This person doesn't have COVID. They've never had a positive either antigen or molecular test that was positive, even though they've been tested multiple times. They don't have the antibody to prove that they had COVID. The current commercial antibodies actually are perfect to test for people like this, to see if they have been infected. Doesn't help you as much with the vaccines, because that's a slightly different antibody. So this person doesn't have, they have something else. I don't know what they had, even though some of the family members had it. They have all these other symptoms, but there's plenty of other diseases out there that can cause this, and they just need a good doctor to investigate to figure out what these symptoms are caused by. But this person does not have COVID.
And this individual,
blood, I understand the patient has O positive blood. That gives you a little benefit from protecting yourself, but it's very incremental.
Amazing. And then our last question for the segment, this individual had GnBar syndrome about 8 years ago, and they are unclear whether to get the vaccine or not. What are your thoughts? Should they get the vaccine?
Guillain-Barré and Bell's palsy, other neurologic problems have been associated with vaccines, and Guillain-Barré in particular, back to even swine flu. It's a very low risk, but it's higher than what's expected in the general population. And it's been reported more with the J&J vaccine. So I think somebody who has a history of Bell's palsy or Guillain-Barré or some other neurologic problem, I would avoid the Johnson & Johnson vaccine and go with one of the mRNA vaccines for now. That's the Pfizer and Moderna. I think that's just the most prudent approach.
Awesome. Those were all of our questions and our headlines for today's segment.
Great, Sophie. Thank you.
Thank you, Dr. Murphy.